Wonderful. I can see we've got 26 people now, and that's great. It's 6:01. So
Okay.
So shall we get started then? Thank you so much for joining, and thank you to everybody who's joining as an attendee. This is on as a webinar with our experts on behalf of Live Better With. So Live Better With is a place where you can come and find all of the practical support that can help if you're living with cancer. So that's if you don't know who we are. And one of the things we do is we have a community forum where we try and bring together as many experts as possible who can help give some real wisdom and advice on living with cancer and all of the different things that may affect day-to-day life, and really try and just help make everyday life a little bit better. And we're really happy today to be joined by Liz Bradley and Karin Sieger. And now Liz is, I'll let them introduce themselves in a second. Liz is our oncology nurse on our platform. Karin Sieger is our emotional wellbeing advisor. And the purpose of today's session is really, we're in quite extraordinary times. None of us have ever lived through something like this before. Clearly, living with coronavirus out there or in our families and in our communities is a whole different world that we all have to get used to living with. But the thing we keep seeing and hearing in the news is, if you're living with a pre-existing condition, or if you're living with some kind of condition, then what does that actually mean? Are you more vulnerable? What are the kind of things that you should or shouldn't be doing? And there's a lot of headline statements, and there's not so much of that detail. And what we really want to try and do in the next hour is just answer as many of the questions as possible that have been coming to us in our forum, and that have been coming to you and you both, and try and hear from you on your advice and tips and so on. Now, to all of you attending, welcome, really welcome, and I hope that you find this webinar useful. If you have a question that we haven't answered yet, if you go to the bottom of your screen, you'll see a Q&A, a little speech bubbles with a Q&A symbol. And if you want to ask a question, just type it there. I'll keep an eye on that. We're going to start with some of the questions that have already come in from our community, and then I'll keep an eye on that, and then we can answer any of your questions in a few minutes' time. So that's really the plan for this. I'm going to start maybe asking Liz and Karin, maybe you could each just give a quick 20-second introduction to yourself, just a couple of lines on your background and what you focus on, and then we'll move into some of the questions. Maybe Liz, do you want to go first?
Lovely. Thanks, Tamara. Yeah, so I'm Liz. I've been an oncology nurse for about 25 years. Mostly spent looking after chemotherapy patients, but I've done a variety of jobs, including breast cancer nurse specialist and haematology nurse specialist. I have also had cancer myself. I was diagnosed with cancer when I was 29, and I went through chemo and radiotherapy, so I have been on the other side of the fence. So I do appreciate how scary the time this is, particularly around coronavirus, and hopefully some of this time that we spend together will help you.
Thank you, Liz. Well, Karin?
Yes, I'm Karin Sieger. I'm a psychotherapist. I have a practice in Richmond in West London. I also support people online. Cancer is one of my areas of speciality, like Liz. I've also been diagnosed and treated for breast cancer twice, so gone through the operation, chemo and radiotherapy. And I also feel the stress of what we're going through at the moment, just like everybody. It's a very anxious time, and there is a lot of useful advice that we can all get, and a lot of things that we can all do for our own well-being.
Thank you both. So I wonder, I'm sure in the last sort of 2-3 weeks you've been approached by people and you've been answering a lot of questions already. And so I wondered if I could just start by asking you, what's the most common question you've been asked so far, and what's the number one thing that's on people's minds that they've been asking you?
Well, in my case, it's uncertainty. Like always with cancer, it's all about uncertainty. And now we've got the double whammy, cancer and coronavirus. So it's how do we deal with that sense of loss of control, uncertainty. Will my treatment happen? Will I get the virus? What about my family? A sense of helplessness, anxiety, and depression, and how we can help ourselves during that time.
Okay. Thank you. And Liz?
I guess from my perspective, it's patients are concerned about, what does shielding actually mean? Do they actually have to stay at home for 12 weeks? What does that look like? You know, we're all very social beings, and I think that's very scary for a lot of people that are going through cancer treatment at the moment, as to how they're going to manage with that whole 12-week period of isolation, and I think just how they're going to be able to go out about their everyday lives and just be normal.
Yes, and we've heard that a lot from our community. So I think the reason I asked this question is just for those of you who are listening, it's entirely normal if you're feeling this, because this is what everybody's feeling. And if you just hear what Liz and Karin just said, these are just things that they're being asked by others all the time. So you're not alone if you're feeling these kind of things right now. Let's come to that topic of how you deal when you're in isolation. I want to start though with thinking a bit about if you're going through treatment at the moment. So we've had several questions about, no, I'm receiving chemotherapy, should I be worried? We've actually had one question from one of our attendees about how safe is it to start chemo with the coronavirus, due to start next Wednesday. So if you're receiving chemotherapy or about to start it, Liz, maybe I could ask you that.
Yeah, sure.
Should I be worried is the question, and what should we do?
Well, I mean, I guess the answer to that is embarking on chemotherapy is naturally, you're going to have these feelings of complete, well, you're going to be anxious anyway, and obviously at this time it's going to incite more anxiety. A lot of our patients are saying, well, will my consultant delay treatment? Can I not have it? And obviously that is a case-by-case discussion that each patient should be having with their oncologist. There are times, or there are scenarios where we would suggest that some patients don't have chemotherapy, but for the most part, for patients that are having chemotherapy post-surgery for curative intent, there is absolutely no reason why chemotherapy should not go ahead. And obviously, as long as you adhere to the strict guidelines that are laid down by your oncology unit, and you maintain the social distancing, and obviously try and keep away from anybody as much as you possibly can, then there isn't any reason why you should not be having chemotherapy treatment.
Okay, thank you very much. It's very, very clear. And to someone who's finished chemo, so we had a question saying, I finished chemo 2 months ago and I feel well. Am I at high risk? Then is there something additional to worry about, or not?
Okay, so the guidance on that has actually changed fairly recently. It was only a couple of weeks ago that we actually said that patients up till 3 months post chemotherapy should really be shielded and stay indoors. But the guidance has actually changed, and actually it's only for patients who are actively on chemotherapy at this precise moment in time, or who have received stem cell transplantation or bone marrow from another recipient, should be the ones that are actively shielding. So there isn't any suggestion that those patients that are there a few months post chemotherapy need to be staying at home for 12 weeks. The body's immune system is very resilient, and as soon as we kickstart the white cells back into operation again, then the body will restart its own natural immunity. So again, the guidance, which is up-to-date guidance, says that if you finish chemotherapy, there is no set time when you finish it. I would suggest leave it a good few weeks to make sure that your chemotherapy is out of your system, but otherwise there is no reason why you need to be at home for the duration.
Thank you very much. There's been a couple of questions coming on exactly that. Finish my chemo, am I vulnerable? So that's super clear. Thank you, Liz. Karin, there's a few questions about the fear, and you mentioned one of the top things you're being asked about and talked to is about the anxiety and the fear and so on. I think one of the questions put it as, is coronavirus fear real? I'm having really bad anxiety since it all started, and I never used to feel like this before. Is it a real fear, real anxiety?
Absolutely. I think nobody on this call will not know what coronavirus fear feels like, and if you don't feel it now, you're very likely to feel it soon. It's very normal. It's also something that we can catch, like the virus, from other people. If we meet people who are perhaps get hysterical, or if we are in group meetings online where people talk in a very frightening manner. So it is very normal. Don't be worried about that. And fear is also good, because fear alerts us sometimes that we may be at threat, and that gives us a chance to think about what are we going to do to look after ourselves, to keep ourselves safe. So don't worry about having fear. It's about the level of fear. If it's constantly peaking and you feel very hyper and you feel panicky, sweating at night, disrupted sleep, you can't think of anything else, then I would say it's really time that you investigate how you can put the fear into proportion and bring it down to a manageable level where it doesn't stand in the life that we all still can and have to lead.
Thank you very much. Thank you. It is really unprecedented times. Had a few more questions come in, Liz, if we could just continue on that. I'm currently undergoing treatment. A couple of questions about if I do stop chemo now, if I do stop chemo mid-cycle, can I continue it at a later date? And if not, why not? To understand, is it possible if you're in chemo to pause till this is over, or is that not usual?
No, it isn't. It's a difficult question, but I'll try and explain it as best I possibly can. But like any course of treatment, it's I'll give an example. It's like taking antibiotics. So if you're put on a course of antibiotics for 14 days from your GP because you've got a throat infection, and then suddenly you decide to stop them after 4 days because you feel better, and then you get decide, actually, I probably ought to restart those, and then you start them a week later, you will go back and undo all of that good work that you did initially. So like any course of treatment, treatment is set out for you. Radiotherapy and chemotherapy are a course of treatment. So the whole point of both of those is the cumulative effect. So one treatment is not going to just miraculously shrink a tumour, whereas 6 cycles of treatment will do just that. So it is the cumulative effect that will do the job, not just stopping and starting, sadly.
Okay, so if you stop mid-cycle, you're back to the beginning again. And that.
Yeah.
Okay. Thank you for that. And then the final treatment-related question we've had come in is, we talked a bit earlier about if you've finished treatment, finished chemo, for example, then how vulnerable are you? What about if you've had a mastectomy? So one of our attendees has had a mastectomy 4 weeks ago. No follow-up treatment is necessary. It does not appear to have been spread. I'm taking letrozole and I'm 73. Am I regarded as vulnerable? So if you've had a mastectomy and no further treatment.
Yeah, okay, so the guidance for over the age of 70 is that sadly maturity is an age is slightly not on side, so anybody over the age of 70 is being advised to be very, very extra cautious. But the fact that you've had a mastectomy and the fact that you're on letrozole does not make your immunity any more susceptible to coronavirus. So there is no risk there with either of those two things.
Great. Thank you very much. So we talked a bit earlier about social distancing, isolating being necessary to try and stay away from other people as much as possible. We had from in our forum quite a number of questions about this, both if you are trying to keep away from others and as someone living with cancer, but also if you're living with someone who still needs to go to work, who still needs to continue on as normal. So we've, both sides of the coin. We've had someone ask, I'm caring for a loved one, I'm still having to go into work. This involves taking the train twice a day. What can I do to keep my wife safe? Do I need to take time off work? And on the same vein, somebody asking that, I'm starting chemo in a month. My husband is a doctor going into hospital in San Francisco daily. Besides isolating myself from the world outside, how do I best isolate at home? while we're living in the same house. So just any advice, somebody living with somebody else, trying to keep as isolated as possible. Any tips from either of you on that, how to think about it, how not to worry?
That it is very difficult. So I think we just need to accept that it is very difficult. It is really important to focus on why we need to do that it is a jolly important and positive thing, because that will help with overcoming the difficulty of doing all of that. I think you need to figure it out together. There need to be some very clear rules, and everybody involved has to stick to them. There also needs to be, excuse me, a backup plan, perhaps an external person, somebody else in the family externally that might be able to come in and also mediate, because those situations can cause a lot of stress and strain in the family. So have somebody, a trusted person that also understands your circumstances and that can advise you. I read there are a lot of practical issues about using bathrooms and kitchens, for example. So the person with the virus should always use those shared rooms last, and then really clean the place thoroughly so that the next person is not likely to get infected. Certain procedures and routines have to be really clearly agreed and adhered to. Liz, I'm sure there's other things that you can add.
Yeah, I was just going to say that Macmillan have got a very succinct some information that's come out about isolating when you're a carer. Really nice guidance, which I'll do a link to after this webinar, because it actually just gives some really clear bullet points about if you are caring for somebody. And so I would suggest that Macmillan would be the good website of choice, and I'll put that information up afterwards.
Great, thank you very much. Thank you. And if you are trying to stay away from as many people as possible, we've had a few questions about can you go outside? So if you go outside, don't come into contact with anyone. Is that okay? Or stay at home?
Obviously, we all need to have some kind of exercise and fresh air. There is a very fine balance, and I'm sure Karin will agree with me, from a mental perspective and well-being perspective, about socially isolating ourselves to the point where we're just non-existent beings. As long as you are practicing, if you go out for a walk and you practice social distancing and you're 6 feet away and you cross the street, if anybody walks past you, then the risk of you catching any kind of bugs is very, very, very small. Whereas the offset of that, of you actually getting some fresh air, some sunshine, some vitamin D, actually it offsets that.
Absolutely, I couldn't agree more. So the benefit is really for our bodies, for our immune system, for our overall well-being, and that all of those, they reinforce each other. I think it's important that you be aware of where you live. I live in an area, I've worked it out now. I have a dog. If I want to walk my dog and don't have to worry much about social distancing, I have to go out at 7 o'clock in the morning and not any later. And that's what I'm doing, because if I do it any later, it all becomes too stressful. So be practical about it. Do it in a way that is also enjoyable. It doesn't have to be a chore, and certainly the fear of social distancing mustn't become a permanent fear and anxiety. So be practical about it and enjoy the time outdoors.
Okay, thank you both. Given all the advice on isolating, we've had some of our community and some of our attendees asking about how to cope with the lack of physical contact. So no hugs. I'm really missing hugs. When can I hug my kids again? When can I hug my husband again? And how do I deal with that? It's definitely a new normal, not being able to be close to those, especially the ones that you're living with. Karin, any advice on that one?
Yes, absolutely. Physical contact is so important for all of us. It really does something to our hormones. It gives us more happy hormones. So if we don't get this, we have this craving. I would say we've got to get through this. There is going to be an end point. It's a really useful period in our lives to learn to appreciate the things that really matter. And I think we can do this, we can get through this also without the touch. And we have to find other ways of showing that we love, that we appreciate, that we care. There are other gestures. People have started writing letters again. People have started drawing pictures. People are singing to each other. People are dancing with each other via Zoom. Be creative. Don't just look at the loss, the temporary loss. Be creative and be inspired by what we can do. We human beings are fantastic. I'm sure you will tap into something and you will think, I never thought it possible. So be positive. This will pass. This will pass.
Thank you. Thank you. We'll move on from the self-isolating point in a moment. We've just had a couple of questions about how to, as being a vulnerable person, how to get a supermarket slot, how to be able to find food, how to get groceries, and so on. And I'm not sure if these questions are coming from the UK or the US. What I can share is from the UK perspective, the government is sharing with the supermarkets data on the people who have been classified as vulnerable, and the supermarkets are going to start to prioritize people who are vulnerable in terms of the delivery slot. So hopefully that will help, at least in the UK. There's also boxes being delivered to those at highest risk, and 1.5 million people have been identified by the NHS as clinically vulnerable, and these are the ones that some of you who are saying you've been told to stay at home for 12 weeks. So there's been 50,000 free food boxes planned and prepared and sent out, and will be delivered. Were delivered last weekend. So I think if you are classified as vulnerable and you're worried about where to get food from, you haven't been able to get an online delivery slot, then ask your GP, ask someone in your local authority how to get one of those and how to register. Your details should have been passed on to the supermarkets and so on. So help should be there, help should be coming. You should not be having to worry about this. So please do reach out and ask those who can help you on that.
And may I just come in on that very quickly? Yeah. It is really important to ask, because some of us are used to be so self-sufficient. We find it difficult to ask a neighbor, to ask a relative, because we might have not been in touch with them for a while and we just feel a bit guilty and uncomfortable. I think at this point in time, you've got to overcome that. You've got to look after yourself, and you will be able to make it up to them later on. Do it. People will be glad to help.
Yeah, I will.
True. And a lot of communities have also organised to help neighbours. Okay. So you maybe go on Facebook, go online, have a look, have a little search for what's in your community, and if people are there to help, there will be people to help. And as Karin says, please do ask. Going to move on. We'll come back to, if anybody else has any questions on isolation or on current treatment or so on, we'll come back to that in a moment. So do pop your questions in the Q&A box. I want to move on to some questions we had in advance about treatment and what's going to happen. Now I know, Liz, you can't predict this at all, but we've had quite a few people concerned about having their current treatment cancelled. What can I do if they cancel? And I'm really worried about being at risk and the possibility of not being able to receive my treatment. So I wonder if, Liz, you could just talk, maybe, I know you can't foresee the future, but just kind of what you see is going on at the moment, and what people think, and then maybe we can come to you, Karin, on there's been lots of questions of how can I not worry, how can I feel a bit calmer about this?
Okay, so I guess my main start point is that the NHS and private providers are absolutely committed to making sure that cancer treatments do go ahead. It's one of the key priorities within the NHS, obviously alongside making sure that we've got enough intensive care beds for our coronavirus victims, patients. We are making sure that there is enough capacity to make sure that we can keep cancer patients treated. I'm not saying that no crystal ball. I don't have a crystal ball for the next few weeks, but as we stand at this precise moment, there is not a shortage of drugs, chemotherapy drugs. There is not a shortage of radiotherapy machines. Patients are still being treated. However, the NHS has put in place some priority guidelines. So the patients are being prioritised sensibly to make sure that those patients that are the top of the priority list are made sure that their treatments will go ahead, that made sure that their radiotherapy goes ahead, make sure their chemotherapy goes ahead, immunotherapy, any of those drug options that we give patients. We're also looking to try and see if there's other ways to give drugs. So not every single patient needs intravenous chemotherapy. Some patients can be switched to tablets. Some patients can have their chemotherapy at intervals of slightly longer period of time. So for example, if you're on a 3-weekly regime, you might be switched to a 6-weekly regime, which means that you don't need to come into the hospital as often. So there are things being done to risk assess, to prioritise, and to make sure that those patients that need their chemotherapy treatment get it, and those the patients that need the radiotherapy treatment also get that as well.
Thank you. And just quickly before Karin, you come in, somebody's asked if chemo is stopped for whatever reason by the hospital before it's finished, will they be offered a new course once life is a little more normal?
Okay, so that's a good question. I can give an example that is my own personal example from the hospital that I work in. We've had several patients who are on perhaps number 5 of their 6 cycles, and they have been told not to go ahead for their 6th cycle because the risk/benefit ratio of actually going ahead with treatment against not going ahead isn't significant enough. So actually you're more likely to be have more chances of catching coronavirus as opposed to being made well from and being cured of cancer. So actually the risk benefit for some of those patients is that you don't have any more, you stop at 5 cycles, for example, out of your 6, and that is deemed to be sufficient.
Okay, thank you. Thanks, Liz. Karin?
Yes, again, this is really difficult because we all think we are important, and as Liz says, in the current climate, clinicians have to prioritize cancer cases, and we all think we are important. We can't possibly be less important. So we need to trust the clinicians, and I would encourage anybody, ask the questions that you need to have answered to understand what's going on. Be prepared, take somebody in with you. This is what we always advise, but especially under the current, in the current climate, make sure you understand the reasoning behind what is said. Secondly, do not underestimate the role that you can play in your own physical well-being. If you learn how to de-stress, stay calm, you're doing what you can, you're asking all the questions of the clinicians, and then you've got to leave it at that. There is a way that we can all drive ourselves nuts, and that is really bad for our immune system, and our immune system, our physical and mental energy needs to be as good as we can get it. Because otherwise, you know, if we are weak in those areas and we have cancer, we're not really helping ourselves. So don't underestimate what you can do at home in order to keep yourself tuned up and keep yourself in a positive mindset as much as you can. And there are a number of techniques, simple techniques that you can do. Have plenty of rest, do things that are calming for you, listen to calming music, do meditation, do mindfulness, do whatever it takes for you. This is a very individual journey, and you will discover what it is that you need to de-stress and stay calm.
Thank you very, very much. We've had a few more questions about, we've got some questions on Facebook as well. What does it mean about treatment? So we've been talking about current treatment, whether it continues or stops, and the need to self-isolate, actually, and some questions about tying those two things together. So if you've got scheduled appointments, but you've been told, or you know that you are vulnerable and you should be self-isolating, can you still go out and go to your appointments?
Absolutely, yes. The key is that you go out for urgent medical needs only, or and that would be classed as an urgent medical need. I know what we've tried to do in my own chemotherapy unit is actually limit the amount of visits. So, for example, instead of patients coming one day for a blood test and the second day for their chemotherapy, we actually now do the whole trip. We do a one-stop shop. So you come on one day and you have the whole lot done. You have your assessment, your bloods are okay. You go forward with chemo. So yes, it's still vitally important that you go to your treatment appointments, for sure.
Okay, thank you. And question: can I go out in my own garden if I'm identified as being at risk? I'm guessing from what you said earlier, yes. Go in your own garden, get some sunshine, or
definitely
sometimes some sunshine and the fresh air.
Definitely, yes, most definitely. Enjoy the garden.
Great, thank you. And quite a few questions on how do I know if I need to self-isolate. So do I just assume, because I'm living with cancer at any different stage, that therefore whether I've had a letter from the government or not, am I vulnerable? Do I classify myself as vulnerable and therefore self-isolate? Or if I haven't had that letter from the government, am I all right if I still interact with my family and so on, at least those in my own household? Any advice on that? That's a hard one.
I guess having a diagnosis of cancer per se does not mean that you need to be locked away for 12 weeks. The whole point of this is to protect those vulnerable individuals who are more at risk of coronavirus. Now, those individuals, for example, would be somebody who was on radiotherapy for lung cancer. So obviously, if you have lung cancer, your lungs are more susceptible and vulnerable. If you're on active chemotherapy, then yes, you are more susceptible and vulnerable. But if you've had a diagnosis of cancer, or you have cancer now, or you have had cancer in the past, does not make you on the vulnerable list as such. The whole point of this is to be rational, and is for drugs and treatments that can push you into a place of being vulnerable. It's not actually the cancer itself. So again, if you haven't had a letter, you might have a diagnosis of cancer or have had a diagnosis of cancer, but that does not make you a vulnerable person, because you're not perhaps on treatments that those vulnerable groups would fall into.
Thank you very much. I can see we've had a few people join since the start, so about just over halfway through. We've covered a range of different topics. We've talked about if you're currently in treatment, if you finished treatment, if you are self-isolating, or you're trying to think about if you're vulnerable, what that actually means in practice, and also what it means emotionally. We'll come to a few more questions now, but if you do have questions on any of those topics, that you think something you're worried about, something you want information, again, if you pop the question in the question and answer box, which is at the bottom of your screen, if you hover over the bottom of your screen, you should be able to see where it says Q&A with little speech bubbles. And then you can put the question in there. We're also taking the questions from the Facebook stream as well, and asking them to Liz and to Karin. So we've had a few additional questions, so these ones they're not on a particular theme. Liz, I've read this, certainly. We've had people say, I've heard that taking vitamin C boosts your immune system and can help fight off the coronavirus. I'd be interested to know your opinion about this. I know this one has been in the news a lot. Any thoughts on that, and what someone should do?
Yeah.
Should take it?
Well, actually, I mean, taking multivitamins is perfectly acceptable. Vitamin C has been shown to perhaps reduce the time that you will have a cold. It does not stop you getting the cold in the first place. That is the analogy with the common cold. Obviously, we're in a different place now with coronavirus, and I'm sure as we stand at this precise moment, there's not been the research to show whether taking vitamin C would be effective in warding off coronavirus. I would err on the side of caution and say probably not. But if people want to take vitamin C, absolutely, it's perfectly acceptable thing to take, as long as it's in the doses that are recommended and not in very, very high doses. And it can actually show to reduce the amount of time you have a cold, but probably not that effective for where we are sitting with COVID-19.
Thank you for that. Karin, a few questions, or a few comments really, that given everything that's going on, it's just a bit depressing. We've had a couple of people writing that their loved ones are going down mentally, and they're worried and they're depressed. If you're living with someone and they're not coping so well at the moment, not coping so well with their treatment, or not coping so well with the world and everything that's going on, any tips, any advice there?
Yes, and I think we're going to hear a lot more about this as days, weeks, and perhaps even months will pass. The psychological impact of this must not be underestimated. Pay attention to what, certainly in the UK, via the NHS, is going to be made available for mental health support. That might not help us immediately, but make sure you are familiar. Budgets have started to be set aside. Somebody who is in active treatment needs to ask their medical team. Some hospitals offer some psychological support. Macmillan does it. Here on the community forum, I'm also available. Reach out to me. You can ask questions. It is going to be a process, and it's really, we need to create a certain mindset that we know how to sort of boost ourselves and keep some hope going, and don't give up now. These are dark times, but they will pass, and we have to find ways of getting through that. Really important to have a daily routine, really important to have a routine that has a bit of continuity with that, what you might have had prior to all of this starting. Get up at the same time, go to bed at the same time, put on your normal daytime clothes, have regular meal times. It's so important to have those regular and reassuring pillars in our daily life, and be active. Occupy your mind with a lot of different things. Set yourself tasks, set yourself goals, talk to people online, on the phone, whatever it takes. So be practical, give the person that you're concerned about, give them practical advice, but also show understanding and some compassion for the difficulty that they're going through. But try not show pity, because sometimes pity can reinforce that feeling of despair that the other person may feel.
Thank you. And we've had a sort of question on the other side of the coin. Everyone around me is panicking. I have terminal cancer, but I'm living life to the fullest and trying to be positive about everything. Is this normal? Should I be feeling worried and stressed too?
No, carry on. Carry on feeling the way you do and inspire others. And you know what? It is perhaps odd to some people who are just starting treatment to hear this. But in the cancer community, a lot of people who've gone through the treatment, and perhaps Liz may relate to that, I certainly can, we think almost, welcome to our world. This is what it's like when we went through it. We had to sort of take extra care. We had to isolate ourselves a bit when we went through treatment. We were worried about our finances. When we were given the diagnosis, the world ended. The world, the way we knew it, ended, and we had to rebuild, and we did it. So some of us, we know what it's like, and we have energy, and we have really good suggestions and ideas. So if you have a terminal diagnosis and you have that positive, upbeat attitude towards your life, the life that you have left, live it to the fullest, and you may inspire other people in doing so.
Thank you. I'm going to just continue on that, Karin. Some people who can't see their family and friends, or don't have family and friends, and don't have someone to talk to. We've had a couple of comments of, I don't know who to speak to or what to do now, and especially now I don't have anything to do and I've been told to stay at home. You mentioned about finding support online. There are various different phone lines and so on. Anything in particular you would add to that in terms of seeking help and finding friends, finding someone going through the same perhaps?
Yes, there is so much online support available. I would just caution a bit. Be always mindful where you sign up, because you might also find, perhaps you might get pulled down by other people, by the way other people speak about their experiences. So choose where you want to align yourself, and check things out carefully. But I would say, play a bit around online. You might actually discover other activities that you want to learn. Playing cards online, I don't know, drawing, learning a language, learn a skill, develop your own interests. There is so much that we can do solitarily without feeling lonely, and it can be quite an enriching experience. If you want more information, drop me a line on the Live Better with Cancer forum, and I can take it forward, and together we can see what useful helplines there might be available.
Thank you, Karin. Yeah, so anybody wants to drop Karin a line, community.livebetterwith.com. There are, I think we're seeing a couple more questions about food availability as well. So just to recap, we're recording this, so you can see the full answer we gave earlier, but if you are worried about receiving food and having access to online priority supermarket slots, the supermarkets have been given the details from the NHS, if you're in the UK, of who is in the vulnerable category, and so hopefully those slots will be released soon. And there are food boxes being prepared and were delivered this weekend by the government, and more to come. I think what both Liz and Karin said is, if you're in any situation where you're worried about how to cope with just the daily living, eating and so on, reach out to people in your community, or to those that you know you could trust, your GP surgery or whoever else. But don't sit and worry. Do reach out and ask someone, and someone will know how to access the kind of support that you need.
Local council websites are also very important. They do a lot of signposting. In my area, it's HUK. They coordinate a lot of activities. So again, those are two areas to look into.
Thank you. Just going to come back to treatments for a few minutes, Liz. I've had a couple more questions about access to treatments as time. Now, you mentioned earlier, again, I'll say again what I said earlier. I know you can't predict the future. It's wonderful, but doesn't know what's about to happen, what's going to happen with access and everything. The NHS is doing everything possible in the UK to keep treatments as normal to the extent possible. if someone is expecting to have heard about an appointment or have heard about treatment so far and hasn't yet, is that something to panic about?
I would say no. Obviously, it does depend on how what the time scale is. Ideally, the NHS would want to start treating patients for chemotherapy within three or so weeks after initial decision that the treatment was to go ahead. I think it would be perfectly valid for if somebody is concerned about the time, actually just ring through to the hospital and actually make an inquiry as to where the state of play is. Again, other hospitals do vary in terms of their waiting times for chemo. It can vary from anything between a week to 5 weeks. So there is some kind of, there is a difference in time lag around waiting times. But I think if you are concerned, then you should actually ring up and actually ask and say, where am I in the queue?
Okay.
Perfectly valid.
Call if you want to know and ask. But
Yeah.
normally there's waiting times, so don't
There
be
is,
too
yeah.
worried that it's something out of the ordinary.
No.
Thank you. And do you know anything about those who are waiting new treatments? So we've had a question about new drugs that were waiting go-aheads for the UK or the US. Are those being postponed? Do you know?
There isn't any talk about anything being postponed at all in terms of cancer drugs. So NHS patients are still being able to access the Cancer Drugs Fund for drugs that are particularly around immunotherapy, and we haven't heard there isn't any sort of sudden stoppage of anything at all. Again, it's always best to just have that discussion with your oncology team and just be upfront and just ask, and that they'll be more than happy to advise you.
Thank you. I can see we've got about 35 people attending. We've got about 10 minutes left. If anyone does have another question, we've got a couple more questions to go through. If anyone is listening and watching and wants to ask Liz or Karin a question about living with cancer and dealing with the world we're living in at the moment with coronavirus, please do type it in that Q&A box. It's at the bottom of your screen on Zoom. You can see little speech bubbles and it says Q&A. We've had loads of really great questions, and I hope this is helping with the kind of answers you're getting. So about 10 minutes left. If you want to ask a question, do pop it in there and we will go through them. Liz, we're just actually on what we were just talking about. Someone's asked that the immunotherapy to which they were responding well has now been stopped, not just temporarily suspended. Is that something widespread, or is that just individual cases? Is that something you've heard of as a policy or anything?
No,
Okay.
no, that's not something. And again, if somebody is concerned about that, they should discuss that reason why that's happened with their healthcare professionals.
Okay, so there's a general message here. If there's something that you don't understand, or you have a question about why you haven't heard about something, why something's been stopped, whether completely or mid-cycle or anything, reach out and call your doctor, your nurse, and ask the question, because there's no national rule in any country about this that we can just apply.
Absolutely.
Thank you. Can you talk a bit, Liz, about the protective equipment that's being used in hospitals at the moment? A couple of concerns about, will the fantastic chemotherapy clinicians be protected? And masks are not being worn routinely. So if attending chemo, is there any kind of precaution that needs to be taken? Are patients being given masks, for example?
Okay, that's a really good question. And again, the guidance is ever changing. But as we stand today, unless we are looking after somebody with symptoms of suspected COVID-19, i.e. if they present to the chemotherapy unit with a high temperature or a persistent cough, then no, caregivers giving chemotherapy will not routinely be wearing masks. We are saving the masks that are needed for the NHS and for caregivers who are really needing that PPE for patients that are suspected and are being cared for with COVID-19. What we are doing in our own chemotherapy unit is that we are actually decided to issue patients with a mask If they would like to wear it, they can. There is absolutely no reason for patients to wear masks either. But again, some patients do feel that they would like to wear one. I haven't actually had many patients take up the offer, but they are being offered a mask for the duration of chemotherapy. But caregivers for chemotherapy administration are not routinely needed to wear masks and visors or anything like that. Obviously, just a normal PPE, which is gloves and aprons.
Okay, thank you. Great, some final questions coming through. There's quite a few different questions here and on Facebook about how do you know if you're vulnerable, and you addressed this earlier, Liz. I think if I summarize what you said, it doesn't mean just because you're living with cancer that you are automatically in the vulnerable group. And so is there any general advice you can give to someone who's worried? Should they consider themselves at risk or not at risk, whether or not you've had a letter telling you you're in the 1.5 million or you're not, in the UK, or generally if you're wherever you are in the world, worried about whether your condition makes you more or less vulnerable than others?
Yeah, I think as we said previously, if you're on active treatment, so if you're on active chemotherapy, or if you're in receipt of a bone marrow transplantation or stem cells, then yes, you would be classed as being in the vulnerable group. Perhaps what I will do after this is just to put up the up-to-date information about what is actually classed as the vulnerable groups, because just having cancer and living with cancer is not, it does not automatically mean that you sit within one of those vulnerable groups. Okay,
thank you very much. I'm just checking what final questions we do have. I think we've answered all of the questions at risk, and about caring. Maybe Karin, there's a few questions about if you're caring for someone, with caring for a loved one, what are the kind of things that you can say or do to reassure them? And I think do practically, but also do to support in a time like this. So if there's a few people saying, you know, I have to go to work, but I do want to support my loved one in the best way I can. How do I keep them safe, but also how do I support them emotionally and mentally as well?
Yes. First of all, as a carer, you have to look out for yourself first. There are a lot of people who immediately give it all away, all the energy, and then they have a burnout, or they can't cope with the stress anymore, and that is of no use to anybody. So your responsibility, and to be of use to anybody, look after yourself first. I know that might not be easy for many of us, but it is essential. Then check what support does the other person actually need. We sometimes think that people with cancer are vulnerable and they need all of this support, and we put them in this cocoon and they don't actually have a chance to get their heads around the situation and start helping themselves. So sometimes by helping people too much, we also make them, they lose independence and they become dependent on us. So don't assume, ask. It has to be worked out together so that you don't overburden yourself and actually take freedom away from the other person. Ask and find a good middle way. I could go on, but I think that is really, really important to understand that as the foundation of anything that you do.
And can I just chip in as well? I think it's so important that carers for patients with cancer have support themselves and actually link in with other carers, because it can be very isolating. And I know that, you know, in my own experience, we've set up support groups for carers and they've been so well received. It's just a cup of tea and a bit of cake. And okay, it's going to probably be done virtually at the moment, but actually that's you know, a cup of tea and a bit of cake that you can share with someone that appreciates how you feel.
Yes, I think sometimes we think it's the person with the cancer that is all important, and of course they and we are important, but carers have emotions too. Cancer affects everybody. You don't need to have cancer to be impacted by cancer, if you see what I mean. So everybody needs their support, and everybody will have feelings, and everybody's lives will have changed because of it. So it's really important to look after your well-being, physically and mentally as well.
For sure.
Thank you both so much. Thanks to everyone for attending. Now, I just want to show, if you want to ask Liz and Karin any more questions, you can find them on the, I'm going to see if this works. You can find them on the forum. So let me see if you can see that on the screen. So you can see there's Liz, Ask an Oncology Specialist Nurse, and there's Karin. So if you want to go to community.livebetterwith.com, you can continue and ask them any questions that you have, and they're there to help. And also, both of them mentioned about finding other people to have a chat with, ask similar questions, anything that's on your mind, or just talk about what you're going through. And there's lots and lots and lots of people on here ready to have a chat. So if you want to talk to anyone and you want to talk to Liz and Karin, you can go to community.livebetterwith.com /cancer, and you'll find them there. So I will wrap up now, but thank you so much to Liz, and thank you so much to Karin. I hope that we've been able to answer many of your questions. If you do have other questions, again, pop them on the forum. We will try and answer them as the days progress, and if there are lots of questions, we can always come back and do another one of these as well, if things change or there's more things on people's mind. But again, thank you both so much, and thanks to everyone for attending, and we wish you all the very best in these coming days and weeks.
Yes, take good care.
Stay safe.
Thank you all. Bye-bye.